Berardi here to answer another question. Common question that we get is differences between filler and Botox. Also, where are fillers commonly used and some places that are often overlooked. Filler is going to address volume loss. Areas where the facial features have descended, causing shadows where we might want to place volume. A very common place is in the cheeks. Botox, however, addresses areas where animation causes the wrinkles, like around the sides of the eyes, or in between the eyes, or even on the forehead. Now we use wonderful products here in the office, Galderma products in particular, like Restylane, Restylane Lift, Refine, Define. Some great areas to use these fillers. One is under the tear troughs. The face is the center of your focus when you're talking to somebody, and often these tear troughs make people look tired. It's this groove that's under the eye that accentuates bags under your eyes. So a great place to inject is in the tear trough, which basically reduces the shadowing in that area, gives you a more less tired, more rested look. Some other areas that are often overlooked are the temples. Many women come in with their cheeks filled with volume, but the temples are often overlooked, and it's a telltale sign of aging with a hollowed out temple. If you look at young women in magazines, and you'll see that the volume flows from your cheek throughout the temple, and it's not often addressed in clinics. So I really focus on that and make sure that we address that with patients. That way they have a very overall youthful and rejuvenated look. Another area that we often do is the hands. The hands get more or the same amount of exposure to the weather just as your face does. So the hands often look aged, and we often neglect the hands. A great thing that we do here is we'll inject filler into the hands, usually Restylane Lift. That really gives the hands a more youthful look, almost a less skeletonized look. We can also do it in the operating room using a person's own fat. So 3 great areas: the tear troughs, the temples, and the hands. Come by and take a look. We can educate you more on this.